welcome once again. Today we reached 1201 days. So today's our guest is Professor Kamalesh Mehta has not yet joined. Dr. Kamalesh Mehta, are you there in any other names? Oh. Okay, Dr. Kamalesh Mehta is, he has MD in homeopathy and homeopathic physician at Mumbai, Surat, and associated with KOSMO Homeopathy and Aesthetic Clinic Homeopathy for Fever Hospital and Hanumanian Gurukul United Homeopathic Organization, and he is a retired professor in the head of the Department of Case Taking and Repertory in CMP Homeopathic Medical College. And today's our topic is sharing of case processing through a case discussion. Okay. Doctor has not yet joined. Let me ask.
Yeah, she is not.
He has to. Sir, Dr. Kamalesh Mehta. Okay, your audio is.
Am I audible?
Yes, sir.
Okay, thank you.
And we have introduced you, and now you can directly go to the class.
Okay. Thank you very much.
Thank you, sir. Welcome to IFPH.
Yeah, it was a wonderful session yesterday. It was 1,200.
Yeah.
You have completed, and congratulations. It is a marathon session that you have run, and excellently you have done very well.
Thank you, sir.
Yeah, and this will set different milestone, and it will inspire a lot of other people to come forward and do such things.
Yeah.
Thank you very much for giving me opportunity for 1,201st webinar of yours. So I will become a part of your history.
Yeah, we all are the part of this IFPH. We, in our travel, everyone is the co-travelers, and we, I don't know when we are going to stop the journey. We will continue this journey with all the companions. Okay.
Journey means it has to go on, it never stops. And I am thankful to Dr.
Don't stop, I think so.
It never, whether it is without or whether it is within, but the journey has to continue.
Yeah.
There is
After a long time, the next generation will hand over. We will hand over to the next generation, and they will continue.
Madam ji, the point is that you are recording and you are putting all the recordings on YouTube. That is available. So that is a treasure.
Yeah.
Tomorrow you are there or no, I am there or no, but the whatever has been done cannot be erased. It will remain there. And I am thankful to Dr. Kalyan Swarup ji, who introduced me to IFPH and gave me opportunity to be with you all people. Sirji, namaste.
Yeah, he's really supporting, and every day
Yes.
he's joining all the webinars. Sir, if you have to share, means you can share now. You are the co-host.
I can share the.
Yeah.
Where is it? Screen share. Okay.
Yeah, screen share.
So hi everybody, and I hope that am I a host? I have to admit people.
No need to admit. I will admit. You can.
You will admit. Okay. Today's topic, that is the I am just sharing my views about case processing. And in the case processing, what I am going to bring to you is nothing new. Every word that I am going to speak and sharing with you, you must maybe knowing about that. Only thing, my job is to integrate and make a collective idea, all of us together, that we can share and evolve together. That is the big idea. And I hope it can be a interactive session. And so wherever you feel you want to share something, you please, you can unmute yourself and you can share your views. It is not that at the end
We
only
have time after the class. We will have 15
question
minutes
answers.
for the
Yes,
question. That will be
yes.
nice. Otherwise, it will.
Yeah, it will also, because I have already shared a case. It is a very open learning. I have already shared a case of Dr. Henneman. He treated in 1815. The entire case and his thinking process has been shared to you. I hope that you have gone through. And if you have not gone through because of any of the reason, don't worry about it. I will share my screen and very quickly we will just have a look, and then my today's schedule is that in 15-20 minutes we if we can learn what Dr. Henneman wanted us to understand, and that we will apply to another case of mine. And so there will be about 2 cases to interact about if time permits. Even we learn only from one case of Dr. Henneman. You know that Dr. Henneman in his lifetime has shared mainly only 2 cases, and both the cases are there in the preamble of Mathematica Pura, and there is also in his lesser writing. And these 2 cases for which he says there is no need to give lots of cases because every case has its own dimension and its own credential and its own merits and its own reasons. And you are not going to get the same case again in the life, because if that is not so, then it is not the matter of individualization. And as soon as we talk about the individualization, we should not go into the stereotype practice. So that is why not the number of cases that matters. What matters is the concept, philosophy, and its application. We have to replicate the results by applying the consistent principles. Okay. So with this, I will just share this case. I am sure you must be all knowing this case. Many of you might have some or other time must have seen. Okay. So my screen is visible to you?
Yes, sir. Yes. Sharing case processing.
Okay, very nice. I hope this is very clear.
Yes, clear.
So today on 15 December, my schedule was changed from 14 to 15. So anyways, the main important point is that we are back to the roots. Unless our roots are very strong and our foundation is very strong, we cannot erect our structure which will last long. So here Hahnemannian concepts to apply to the practice through his case itself, the case of a washerwoman of 40 years, and since 3 weeks she is not able to go to her job because of the severe complaints she was having. This case was taken on 1st September 1815. This we all are also doing in our practice, which is known as preliminary data. So this is the exact wordings that Hahnemann has put forward in his case record. He has not given these yellow headings which I have given here. This is a symptom number 1, that on any movement, especially at every step and making false step, it is becoming worse. What is becoming worse is a should in scobiculus cordis. Scobiculus cordis is a epigastric region, stomach region. That comes as she avers every time from the left side. If you have you have the paper and pen and you are, please write down this word avers. Avers means he has confirmed. And another is every time. Please put the notation on every time from left side. This is helping us to understand how he has worked on the cases. He has not just collected data, he has confirmed data, and he is looking for the consistent, persistent symptoms. When she lies, she feels quite well, then she has no pain anywhere, neither in the side nor in the scobiculus. So this is something this is second point. See, everything is part of one symptom only. But how is noting down the symptoms that we have to understand here in the beginning, what he has taken down, the chief complaint, the modalities are coming up, then sensations are coming up, shooting pain. Then locations are coming up, direction is coming up, and he is confirming the symptom. These are everything that we know. Maybe we are practicing. Are we practicing with full awareness or no? That is the important point that we have to examine in ourselves. She cannot sleep after 3 o'clock in the morning. She relishes her food, but when she has ate a little, she feels sick. Please put your underline under but. She relishes her food, but when she has ate a little, she feels sick. Then the water collects in her mouth and runs out of it like the water brush. She has frequently empty eructations after every meal. So this is one complaint that she has said about the pain in the epigastric region, and along with that, the symptoms are coming about water brush and eructations and other things. Its relation with the food that is coming up, and again modalities. The seventh symptom is her temper is passionate. She is quite patient, disposed to anger. Whenever the pain is severe, she is covered with perspiration. Catamania means menses were quite regular, a fortnight since. In other respect, her health is good. So in other respect, means he has examined all the various other aspects of the case, but in short, he mentions that other aspects. So what do we see here? There is a temperament. Please underline temperament. So another word that is important is disposed to. That speaks about the disposition. General reaction he is giving, that with the pain, what is happening to her, how her system in general reacting, and we know that this remedy is very, very clear from as it is a bryonia. Why? Because we know least movement aggravation, false step aggravation, and very angry, irritable patient. We can easily prescribe bryonia. The case was open to you, so and his entire thinking process has been given to you. So I am not hiding any remedy, bryonia. But what is important is, if we repertorize, we know that in 1816, he had his own personal repertory made in Latin. And he was referring that, but obviously we don't have that. So what we have is therapeutic pocketbook, the first and the best disciple of Dr. Hahnemann, who knew Hahnemann's application of his concepts in and out. So we just take a reference from therapeutic pocketbook, motion aggravation, after midnight aggravation, sensation is forcing, forcing, and aggression or false motion, false step aggression. So with that we get bryonia. Now in today's time we have better repertories, so we take refer better repertories. In better repertories, now we have in therapeutic pocket book, we know that there are only 16 to 17 mental states are given, whereas here we are getting further references like his temperament, passionate, then midnight after 3 a.m. aggravation, means there in therapeutic pocket book, there is a general that after midnight aggravation, here after 3 a.m. aggravation, we have shooting, darting, lightning, pain in specific, we can see motion aggravation, and rest amelioration and force step aggravation. Here bryonia, but in bryonia, the shooting pain is not given in repertory at this point of time. Taking the further references, in the current complete repertory, bryonia has been included there along with other 999 drugs. So bryonia is coming up from his thinking also. Brian is coming from repertory also, and he has given very categorically what are the symptoms and what is the symptom number which he has studied in the Mathematica Pura. I don't know whether you have gone through the case or no. Otherwise, what I'm talking, I'm considering that you have gone through the case and I'm talking about that. So just let me know you have gone through the case. Hello.
Yes, sir, we are listening. Don't worry, you proceed.
Okay. Okay, so his work was very precise, taking utmost pain of correlating patient symptom into the materia medica pura, the patient's language, wordings, same into the materia medica pura where proving was recorded. And he has given which symptom he has correlated, giving the number next to the symptom. Now, from this, what do we derive that is very important? We can see his case taking in 1815. So by that time, there was fourth edition of Organon available. Then what we have learned, there is from sixth edition, and then now we are so much evolved in this 21st century. So we can let us understand from 1815, by 1815 what he had derived and what he wanted us to learn. That primary preliminary information is very important, whereby we get age, gender, occupation. We know that aphorism number 5, occupation, necessary symptoms are very important to learn. Likewise, the different problems with different age, different gender, different social status, everything that has been described in the aphorism number 5. State of the patient during his sickness and impact of the sickness on the patient. That is what if we see, he has taken that what has happened after this problem since 3 weeks, what is the impact? Her point is that I cannot join my business. I cannot conduct it. And the third point in the case taking important is we must confirm and be sure about every symptom. Don't just take things for granted. Forget about the hypothesis that he has said in footnote number 1. So don't hypothesize, don't speculate. There is a different thing. He has gone to much more ahead that be firm, be sure and confirm about the symptom. Then, very important is constant usual recurring symptoms. He avers and confirmed that every time, means constantly, usually this symptom is occurring, that every time it is coming from the left side. Then what characterizes this symptom? That is very important. Aphorism number 153 that you will see further. So for he says again, you focus on morbid phenomenon. He has taken the evolution in that. He has talked about the negative symptoms and temperament and disposition. And seventh one is be specific about the case. If you write down all these underlying things, state of the patient during the illness, impact of the sickness, confirmation of the symptoms, constant usual recurrence of the symptom. Dr. Sehgal has said this about the persistent symptom. And morbid phenomena negative now get. Most important is be specific about every symptom. And other general affections, the way she's getting perspiration with the pain, and other affections like other GIT problems apart from the pain. So these are the things it suggests us to look into when we are considering the taking up the case. And more ketamania is normal, no other changes. So always take into account change in physiological functioning like appetite, defecation, urination, digestion, everything. Okay. Now, after case is taken, what comes is a case processing. In case processing, the first part is, first of all, we have to deal with the symptoms. You have to understand, is it a symptom or it is not a symptom? If it is a distressful to the patient, that is a symptom. And if it is to be corrected, that is a symptom. So dealing with the symptom, first is selection of symptoms. And second is what is characterizing this symptom. Now, so how do you select symptoms? The same thing, what you have learned, we are applying here, that symptoms should be confirmed, it will be persistent, and they should be defined. And what characterizes the symptom? Modalities characterize the symptom, morbid phenomenon can characterize negative symptoms, alternating symptoms, temperament and disposition. These things characterize the symptoms. But how, what? This is what I am just giving you the cream of everything. Let us see if we can understand its application. After the symptoms we have worked, then what do? We correlate symptoms with relevant medicines. Whatever I have mentioned here, everything has been mentioned in preamble of Materia Medica Pura, but maybe little in the different words. He has given the total one paragraph, how will you solve any case? He has written there, jot down each symptom, and then in front of each symptom, jot down all the medicines which can produce such a symptom. So curative power of the remedy. Aphorism number 3. Mention medicine names in abbreviated form, so that if you have to repeat again and again, it can be done easily. Okay, so most important is take the symptom and write down the relevant medicines. Then third is narrow down group of medicines. Whatever group of medicines you have found, how will I narrow down? First, very important, he says modalities characterizes every symptom. So modality, because modalities are reaction of the person, never of a disease. Every person has a different reactivity. And so they are sensitive to different modifying factors. And these different modifying factors will obviously help us in individualizing and characterizing symptom very easily. So modalities will determine the medicine. Always this is something very important. Consider alternating symptoms, negative symptoms, and temperament disposition in the case to distinguish seemingly similar medicine from each other. We know that he has given example of aconite and chamomile in organon, that if temperament does not match, and child is very playful and mild or quiet, don't give chamomilla. So this temperament and disposition is utmost important. Even Boni Hussain has said that after you come to the collection of the drugs, group of the drugs, if you want to differentiate them and you don't have any even characteristics at the level of the disposition, but disposition will help you to differentiate them. So always these are the things, modalities, alternating symptoms, negative symptoms, temperament, disposition. These are very important things. Then pursue which of the medicines homeopathically. Homeopathically means based on law of similia, covers most of the symptoms, especially most peculiar and characteristic ones. So here he says modalities, peculiarizes and characterizes, and whatever are other characteristic symptoms, consider them to differentiate. And this most peculiar characteristic aspect we have to look into what? Alternating symptom, negative symptom, temperament and disposition, and then we make use of that in the best possible way. Now, selection of medicine, which has to be homeopathic to the case. This is the most vital thing for which we have undertaken an entire exercise. So for select, now ultimately group of the drugs we have, and we have to select one remedy. So in the process, what we will do, again the same thing. We will depend those symptoms which are sure and constantly usually recurring symptom. We will take them first and we will depend on them first for selection of the remedy. For example, he has written the shoot in the scobiculus every time from the left side. So this symptom is very sure. He has confirmed this symptom, that pain in the epigastrium, which is shooting type, which every time comes from the left side. So this is the most important characteristic symptom he has taken up, that he can depend on this symptom. And for that, he has given reference of his Bryonia symptom 708, that with shooting pain in the left side. Second, when now we are selecting the medicine, so whatever we have undertaken, we are just revising and organizing in the very systematic manner. Symptoms which are common to many drugs, they lose their ability to distinguish drugs further. So they are not helpful to us. He has applied that she cannot sleep after 3 o'clock in the morning. And he says that this is found in many medicines. So this symptom, though it is having a modality and a general symptom like sleeplessness, but this will not help you to differentiate, because after certain limit, it will lose the capacity to distinguish remedies. Likewise, sickness after eating. This is also found in so many other drugs. So when the drugs which you can't differentiate further, those remedies, those symptoms are useless for us. Then the symptoms of case with alternating actions of every related medicine. Alternating actions are given in aphorism number 115. And what is alternating action? Anybody would like to say? It is alternating. It is a primary action, but where symptoms are coming alternate, opposite to each other. Unexpectedly, opposite symptoms come up in the primary action, and then it is followed by secondary action. So this, after one symptom coming up, if another symptom follow, we usually feel it is a secondary action. No, it is opposite thing comes up and then secondary symptom comes up. We know that secondary symptom is the reaction of the system, vital force, in opposition to the primary action of the remedy. So alternating action by itself, by default, is a very, very important, which characterizes symptom to the great extent. So each case, if there are any opposite, now that but, what that but means, there is opposition. Opposite things are coming up. For example,
Match the symptoms of case with all related medicine.
yes, somebody wants to put across something? Okay.
Sir, please proceed.
Yes, yes, yes. So now he talks about pulsatilla, that shooting pain in the epigastrium aggravating from the fourth step. This is mentioned in pulsatilla, but he does not select pulsatilla, giving because this is not as a alternating symptom observed every time in most of the provers in pulsatilla. It is the occasional, rare alternating symptom. That is why you should not trust this for selecting a remedy. Are you getting my point? I hope I am very clear in explanation.
Yes, sir. Proceed.
Yeah, thank you. Sickness after eating with relish for food matches with bryonia. He's sick after eating, but he relishes food. But so this goes as a opposite, so alternating symptom. And this alternating symptom is found in bryonia, symptom number 279, after eating food that he relishes. So the first part is that he feels sick, and after eating food that he relishes. We will come to understand the meaning of what I am putting across subsequently. Negative symptom. Negative symptom means we expect that to happen, but that is not there. In clinical conditions, we see that if a patient is having cough since quite some time, but we ask, do you have evening rise of fever? Patient says no. So we rule out tuberculosis. So we take up that what is expected, it is not there. Clinically, we do that. Likewise, in homeopathic materia medica, so many diarrhea, but absence of weakness. Phosphoric acid, tuberculinum bovinum, proton T, there are so many remedies where there is a weakness, absence of, despite of having lots of diarrhea. But what is expected in case of arsenic, little loss of fluid or few diarrhea and unexpected out of proportion weakness comes up. So when in the case of diarrhea, there is no weakness coming up, we will not prescribe arsenical, that becomes negative symptom for arsenical. Absolutely no pain on lying down. See, this patient otherwise is having lots of pain on least movement, even on the false step. But when patient is lying down, there is no pain. How it becomes negative symptom in this case? Because what is the diagnosis? Gastritis. So inflammation of the stomach. How come inflammation of the stomach is not active when patient is lying down? If it is inflammation, it has to continue. Now on the movement, jerks or false step, we expect it to increase. That is okay. But on lying down and taking rest, the process of inflammation is expected to continue, but it is not continuing. So that is what he says, that absolutely no pain on lying down. So this negative symptom helped him, referring 558 symptom of bryonia, less when at rest than when moving. So when we are studying drugs, we are actually studying them in a very crude, in a very general manner, at the cost of the specificity. When we say patient is better by rest and worse by movement. We have to combine this because that is the particular manner it has come in the proving. See, in the proving, the entire thing has come less when at rest than when moving. So that both the things are coming up in the case. Opt for complete resemblance, never partial resemblance. And we have to refer Mathematica and don't opt for any partial correlationship. Mathematica means original proving, not any commentaries, not any demonstrations or stories about the remedies. Pulsatilla, though the symptom is covered by false step aggravation, but similar digestive disorder and disposition not within it in its curative power. This patient is disposed to anger, whereas pulsatilla, this anger is not very obviously known. This disposition is not known in pulsatilla. So it is not the partial, but the complete correlation is very important. Rustox nux vomica may be with alternating actions, but not suitable for other symptoms. So that is why you should not always take the complete resemblance. Match characteristic and peculiar symptoms, especially modalities of the case to medicine. For example, belladonna, Rustox China, at the first instance only says that shooting pain works by false step and movement. But shooting pain is covered by these three things, but not only on motion. They have various other modalities. Now, bryonia has precisely, very predominantly aggravation by motion. So that is why we have to not take the symptoms quantitatively, but we have to understand qualitatively. Because what we are doing repertorization, we take the summations and we say this is the highest grade and then we tend to prescribe. Okay. The concept of analogy was practiced by Dr. Henneman even in 1815. Now, least movement is aggravating the pain in epigastrum in this case. Now, this particular symptom is taken by him, that is 528th symptom, whereby, 448 symptom. Aggravation by raising right arm. This patient, there is no aggravation by raising right arm. Raising right arm is aggravating something else in the patient, prover of the bryonia. But that he is taking up as a least movement. And pain in trochanter starting shooting on making a false step. So in entire bryonia proving, false step is coming up in 528th symptom, which is related with the pain in the trochanter, not with the stomach. So whatever is true for one part can be true for other parts. That is the analogies. So it is not, he is relating symptoms only to one particular part. He says, okay, false step can create problem in one part. So why cannot it? So it is the sensitivity to false step has to be treated. So sensitivity to false step to be treated, and that is within the curative power of bryonia. So bryonia can be selected. So that is the entire base how therapeutic pocketbook has been made. Location, sensation, modalities. Irrespective of which location, irrespective of which sensation, irrespective of which modality. So if bryonia can treat false step aggravation in one part, it can treat another part also. Stitch like tearing from the feet up to house. House means popliteal fossa, back of knee. Less when at least than when moving. So this is again, this is related with the popliteal fossa, that modality is using somewhere else. So this is the analogy. Temperament and condition, disposition should be within curative power of the medicine. We know that the patient is very disposed to anger. So very irritable disposition, cross, inclined to anger, 771 and 772 symptom. Disposition at once, angry, cross, and lachrymose, 776. Now, where is the passionate word written in proving? It is not given. It is written raving about business for an hour. So that is the passion. For 1 hour, that in the proving, he was with the business, enjoying business, talking about business and involved in the business. And that symptom is 766. I hope this is clear. If any question you may ask me regarding this, we can discuss about it further. So according to him, Bryonia alone has among its chief alternating action, negative symptoms, disposition, temperament, modalities and sensation, other symptoms of digestive system in their total resemblance. In 7 symptoms, he has perceived the patient. Aphorism number 3, perceiving disease. He has perceived in its totality and correlated everything with the Bryonia proving. So what do we understand from this? How do we understand symptoms? That symptoms are general type and characteristic type. I am talking about, absolutely I am talking here aphorism number 153 and other aphorisms. So symptoms he considers of a 2 type only, general and characteristics. What is general? Non-defined and vague, non-specific is general. General means common, applicable to undistinguished. So it is applicable to many drugs. It is applicable to many diseases. So it is non-defined and vague. So exactly opposite to that, what is, so he gives here example, say anxiety, sleeplessness, restlessness, headache, weakness, diarrhea. When they are not defined, but they are mentioned in specific, in general, so they are general symptoms. I am not talking about physical general symptoms. General means applicable to, in general, to whole mass, to many, which is undistinguishable. What is characteristic? Defined and specific. That is characteristic. If we have symptom is defined and specific, it means we know that location, sensation, modality will define. That is where Bonimission brought the idea. How will what characterizes the symptom? That is the title of Bonimission. In that he has written qui, lubi, cur, quibus, oxalis, qumodo, quiondo. It means this is something that defines the symptom. How will we analyze and evaluate symptoms? So in analysis, we have symptom which belongs to temperament and disposition, which is alternating symptom, which is negative symptom, which is complete symptom, that is specific, that specifies. So complete symptom, accessory symptoms. All these accessory symptoms are given under aphorism number 5 in the form of ascertainable constitutional symptoms, then occupation, then social, sexual, all those things, lifestyle problems, everything that is mentioned in aphorism number 5. But whatever symptoms, temperament, disposition, alternating, negative, complete, or accessory, they must be confirmed and persistent. This is something very important. Then those symptoms will have the weightage. Then how will we evaluate them? The evaluation he is already given in, for example, number 153. We all know day in and day out we speak. Only thing we have to practice that. The symptom, the first important symptom in its order comes striking. Second will come singular. Third will come uncommon. And fourth is peculiar. I am not talking about PQRS. I am not changing the words. Striking, singular, uncommon, peculiar. SSUP. Striking, singular, uncommon, peculiar. Okay, so this is what I derived, I learned from this case. This case I must have presented at least for 50 times to various groups, and every time I learn and I derive, I understand something different and I evolve with this case. And with this case, my practice has brought a change phase by phase. So I felt that I will share this case processing that Haneman had conducted with you. I hope this you have found useful, and if time permits, we can go for the second case or we can go for question answers. So moderator will let me know what is good for the session.
Thank you, sir. Dr. Sridharakurup sir has already raised his hand. Dr. Sridharakurup sir, please. You can unmute yourself and ask question.
Sir, your class was fantastic. A big salute for you. Sir, this is the real class that I saw so many classes. This is one of the best class. So about 1,201 case. How to do you? It is not important to give the fish, but how to catch the fish. That is the most important. You are shown how to catch the fish. That is the most important. That from the Hanuman's time onwards, that is praise come, but that you can take another case into another class. Most welcome. Our forum is open for you for any time you ask that our coordinator, Dr. Danesh, you will get. Again, we like to hear from you, sir. It is excellent. There may be other people also like to ask questions, but I don't have any, because your explanation is very clear and excellent. Thank you, sir. Keep it a big salute for you, sir.
Yes,
Thank
sir. My humble suggestion is that after building up this concept and foundation of the principles, if next sometime after whenever it is possible, but not after very too long period of time, if we can solve one case based on this particular, that how to select a striking symptom, how to select a singular symptom, how to select uncommon and peculiar symptom, and what that makes sense in prescribing any case. So if we can have that opportunity, then today's purpose and the time spent, that will be more meaningful.
Definitely, sir. It is very useful. Come again that other cases also. Because we are having now more people that still that you must have to get the coordinator, you approach that Dr. Danesh, then definitely
Sure, sir.
we are benefited. Not only everyone is benefited, what I feel. Of course, seniors and juniors, all are benefited, sir. A big salute. Thank you very much.
Yeah, sir, we have about 10 minutes, so if anybody has any...
Yes, there are so many other doctors also here. They can speak, senior and junior.
Yes, Dr. Kalyan Swarup is
yes, he is one of the
teacher
Please,
of organ.
please unmute yourself, sir. Please, you can.
Dr. Kalyan Swarup, please unmute yourself.
Unmute yourself, sir, please. Okay, Sabairu.
Sir, Kalyan Swarup, sir, please
Hi,
unmute.
audible.
Yes, now audible, now audible.
Many thanks to Dr. Kamalesh Mehta ji. You are giving a very fine lecture and very deep lecture on organelle. I think a homeopath doctor must be a competent master of organelle with materia medica.
Yes, sir.
Once I have heard with Dr. S.P. Day of Calcutta, He was the renowned physician of Calcutta. He said, homeopathic treatment without following the rule and regulation is just like the appreciation of shape of an elephant by touching the portion by the blind man. So every homeopath first try to learn organon, then try to learn materia medica, then he became a success homeopath. So I am very glad to see you on the face-to-face, and your lecture is very fine, sir. You always try to come in this platform, sir. This is my request to you.
Thank you very much, sir, your blessings. And if group is interested, please go through the
Yes.
another case of Dr. Henneman from the
Okay, sir.
Madhya. He has given only 2 cases. Please go through the second case and apply whatever we have derived in the first case. And that case will be very clear cut, and you will be able to distinguish various aspects in the case.
Okay, sir. Okay.
And Dr. Tessetin Illeri from Turkey, right?
Yeah.
Yeah. So you can ask now, please.
First, thank you very much for this very good lecture. What I want to ask, in this study, Hahnemann selected crude form of bryonia in those times, since the patient is very robust. What was your selection in today's potency selection? What is the posology?
Okay, I think this is a very vital question, and we all are wrestling with these potential selection issues. Looking back in 18th century, the principle of homeopathy was law of similia. That was the ground. So whenever whatever it can cause, it can cure. When prescription is based on that, then that medicine is homeopathic to the case. So irrespective of the potency, irrespective of susceptibility, irrespective of everything, the first and foremost thing that if it can cause, that can cure. That is why he prescribed bryonia in the pure form of the juice. Now, we have to correlate that. He evolved subsequently in the 6th section. We have to understand aphorism number 26. Weaker dynamic affection is extinguished by the stronger one. It has to be similar to that. So we have to understand the strength of the disease. We have to understand the strength of the disease. We want to remove that. We have to make it weaker. Our system was weaker, and that factors were stronger enough to alter our state and produce discomfort or alterations in ourselves. So now we have to remove it. We have to make it weaker. To make it weaker, we have to find little stronger, but similar of its type, so that it can remove it. So now the point is, we have various further vision that he has given about the disposition, he has given about the morbid phenomena, he has given about various factors that can alter our condition. He has added miasm into that. So taking everything into account, that is what he says in aphorism number 7, that after we have done our job up to aphorism number 6, now what we should be doing. The first word is of now. So that is required to be done. And considering the strength of the disease, we have to decide the strength of the medicine. Now about that, he has given the strength. You give either medicine by itself, but what he is suggesting, don't give direct medicine, always dilute. And give the dose diluted, because we require very minimal thing to correct ourselves. So this will come from practice and the experience, because it is a personal judgment about the strength of the disease. And accordingly, we prescribe the remedy, and we have the capacity to alter If I find that my potency is inadequate, I can always change my potency. But the only simple rule is aphorism number 26, to decide little stronger than the disease, to make it weaker.
Thank you
Okay,
very
so
much.
he has written that. He has written, patient is so robust, so I gave the strongest dose. Because that is the pure form, without any dilution, without any potentization. Okay?
Thank you very
sir.
much.
Okay.
And no one else? We have 3 more minutes. If anyone in one more participant can ask something, 3 more minutes. Anyone interested? Dr. Sheetal.
I am Dr. Sridhara Kurup. I like to add, not to question,
okay.
I got that once, the time of the Hanuman, that some potencies, there was no potency that time, only the name of the medicine. That I got few medicines from about 200 years back, medicine I got whether accidentally or luckily, that one day night I got a very severe abdominal pain. It was Naxomica symptom. That I took that medicine, few pills, that there was not any that the potency that I got it effect. That means those days there was no potencies at all. First, that earlier times, about 200 years back, there was no potency. There was only that not mentioned beginning. Hanuman was not used to the potency. He was only a potentist, but it was not mentioned what potency. That was also, it was, we must have to notice that also. That I got, I don't know, somewhere I missed that the box, that about to the 20-25 medicines were in that box. I got it from Germany, one of my friend that who sent it to me. That there was, was not mentioned that the any potency at all, only the name of the medicine. Okay, so there was no beginning, he was not used, but later age, he, one after the another, he proved, and then he made these rules one after the another, what according to my knowledge and my understanding. Thank you very much. Well, I want to mention in that. That is why I raised my hand.
Thank you, Dr. Sridhara Kurup, sir. And thank you very much, Dr. Kamalesh Mehta. Actually, we need your classes more in our platform. So come again and be the part of IFPH. We need such a legends in our platform. So thank you so much for coming and joining with us on behalf of IFPH, and all the participants are giving thank you to you through my words. Thank you so much, and good night, everyone.
It is my privilege, madam. It is a privilege to be with you all people now today, and not any time, but every time.
Thank you so much.
Always with IFPH.
Thank you so much. Such words gives IFPH the inspirational words that hearing from you. Thank you so much, sir. Now we are moving to another language in our local language, Malayalam. We have one more session, so it's the time for the Malayalam session, and I'm inviting Dr. Shaila for moderating Malayalam session. And good night, everyone.